If I told you that for much of the Victorian era, giving birth in a hospital could be more dangerous than giving birth at home, you might not believe me. But some doctors and medical students moved from dissecting dead bodies to examining women in labour without properly washing their hands. They could successfully deliver a healthy baby, leave the room, and unknowingly leave behind an infection that killed the mother days later. So what actually happened when a Victorian woman went into labour, and why could the person trying to save her become the greatest danger in the room? For most Victorian women, labour began at home. There was no ambulance waiting outside, no prenatal scan, and often no doctor present. Instead, a local midwife arrived with practical experience and whatever basic supplies the household could provide. She watched the labour, supported the mother, and called for a doctor if something went seriously wrong. Wealthier families increasingly hired male doctors, partly because doctors had access to instruments that midwives generally did not use. The most important were forceps, two curved metal blades designed to fit carefully around a baby's head during a difficult birth. Used skillfully, they could help save both mother and baby. Used incorrectly, they could cause serious injury. And without modern scans or monitors, the doctor often had to determine the baby's position using touch alone. But the greatest threat did not always appear during the birth. A woman could survive labour, hold her baby and appear to be recovering, then develop a severe fever several days later. This was puerperal fever, also known as childbed fever. It could move rapidly through maternity wards, but doctors did not yet understand that invisible microorganisms were spreading it. That made early lying-in hospitals especially dangerous. Bringing many labouring women together appeared efficient, but it also allowed infection to pass from one patient to another. Doctors and students handled sick patients and dead bodies, then examined women using hands and instruments that had not been properly cleaned. Midwives generally dealt with healthy pregnant women and did not move between autopsies and maternity wards. Their patients could therefore experience much lower rates of infection. In 1847, a Hungarian doctor named Ignaz Semmelweis noticed this disturbing difference. He required medical staff to wash their hands before entering his maternity ward. The number of women dying fell dramatically, but instead of transforming medicine immediately, his discovery was resisted. Germ theory had not yet been widely accepted, and many doctors refused to believe that their own hands were carrying death. So, one of the most effective protections available during Victorian childbirth was not an advanced machine or an expensive medicine, it was simply washing. Pain was another problem. In early Queen Victoria's reign, women usually experienced labour without effective anaesthesia. Early religious and medical authorities argued that childbirth pain was natural, necessary, or divinely intended. Then, in 1847, Scottish obstetrician James Young Simpson began using chloroform during labour. It could greatly reduce pain, but it was not risk-free and required careful administration. The treatment remained controversial until 1853, when physician John Snow gave chloroform to Queen Victoria during the birth of Prince Leopold. Royal approval helped transform public opinion. Chloroform use spread among women who could access experienced medical care, but it could not prevent severe bleeding, obstructed labour, or infection. And for poorer women giving birth in overcrowded rooms, even basic cleanliness could be difficult. Conditions slowly improved later in the century as germ theory gained acceptance and Joseph Lister promoted antiseptic medical practice. Doctors increasingly cleaned their hands, instruments, and surroundings instead of treating blood and dirt as harmless parts of their work. Hospitals gradually became safer, but throughout most of the Victorian period, home remained the normal place to give birth. So what happened when a Victorian woman went into labour? Usually she gave birth in her own bed, surrounded by a midwife, female relatives or neighbours. A doctor might arrive with forceps if the delivery became difficult. Chloroform might reduce the pain if she was wealthy, lived later in the century, and had access to someone trained to administer it. But the difference between recovery and death could depend on something nobody in the room could see. The most dangerous person at a Victorian birth was not always the least experienced. Sometimes it was the doctor who had just come from the hospital and had not washed his hands. Would you rather give birth at home with an experienced Victorian midwife or inside an early maternity hospital with a doctor?